Okay, so hi everyone, this is Dr. Akram here. So I'm an Indian pharmacist. I completed my diploma in pharmacy, Bachelor of Pharmacy, and pharmd PB from India. And I have completed my PhD from University of Sydney, Australia. I have around 10 years of teaching experience in India, Malaysia, and Australia. Okay, so I'm going to discuss today the opportunities for you in Australia and New Zealand. And if you have any questions, you can ask me after end of this webinar. Okay. So Academically is a company based in Australia. Right now I am in Sydney. Basically, I'm providing presenting this session to you. So we provide assistance for all healthcare professionals only. Medical doctors, dentists, pharmacists, nurses, physiotherapists, and so on. Any healthcare like lab technicians, optometrists, veterinary doctors. So any healthcare professional looking to migrate abroad, we assist them to complete the process so easily they can migrate in their desired country. This is a little bit about myself. As I mentioned, around I have 10 years of teaching experience in India, Malaysia, and Australia. So I'm Indian pharmacist. I'm working living in Australia. So academically provide the two basic services. One is the study abroad. Uh, if you want to do any master degree after your degree, and we can help you get your admission done. But personally, I do not recommend to anyone go for this pathway because you have to invest a lot of money. You need to pay around 30 to 50 lakh Indian rupees fees to study in abroad for this course. Okay. So what is the best way? The best way is the you can become a pharmacist. You can start your registration process. You can register pharmacist in Australia and you can work as a pharmacist here in Australia. So for pharmacists, um, there is no work experience required to work in Australia. So if you are a fresher, you can work in Australia. So there is a two type of the visa or jobs are available in Australia. It's called retail pharmacist. Another one is the hospital pharmacist. Both you are eligible to work. So basically, number one step, there is some steps you need to complete in order to migrate to Australia. The first step called uh, skill assessment, or we also call document verification. So they want to check your degree from which you did your Bachelor of Pharmacy or PharmD, whatever your degree. And they also want to check your registration as a pharmacist in the State Pharmacy Council. Okay. So we will complete this process for you. We will help you. And then next step is the KAPS exam. So KAPS exam is a knowledge assessment of pharmaceutical sciences. So this exam you need to write in your home country in India. So we will provide you the coaching for 4 months for this exam. Then easily you can write this exam, pass this exam in India. Then you can migrate to Australia. Basically, there's so many centers like Delhi, Noida, Gurgaon, and Pune, Mumbai, Bangalore, Hyderabad, Chennai. These are the exam centers. You have to go to write the exam. So Australian Pharmacy Council conduct this exam, Government of Australia. They need lot of pharmacists. That's why they are connected to all these exams. This is the opportunity for you to migrate to Australia as a pharmacist. And once you pass this CAPS exam, then you also need to pass the English test. This is IELTS or OET or PT. We will also provide you the coaching for this. So all these steps academically will help you to complete. So no need to worry. And then you also, if someone already working as an industry pharmacist, someone completed their degree, B Pharm, M Pharm, or PharmD, now they are working in any industry. So in that case, if you have 2 year work experience after your degree, then you can migrate as a digital pharmacist. We also help them. If someone completed degree and have a 1 year work experience in technician, then we also help you to migrate to Australia as a pharmacy technician. Okay. So skill assessment and English test and all those things we will help you to. So Australia and New Zealand have the same steps to migrate. The other three steps, as I mentioned earlier, one step is skill assessment. The step two is the CAPS exam. Then step three is the English test. So all these three will help you to complete. So there is some difference in Australia and New Zealand requirement. So first of all, Australia does not require any work experience. Zero work experience, you can migrate to Australia. But if you need to migrate New Zealand, at least 1 year work experience need for New Zealand. Secondly, basically, Australia provides unlimited attempt for the exam. If you fail in first time, second time, third time, you can give as many times you want. And but New Zealand, you only can give the two attempt. Okay. And New Zealand is a very small country, very small country as compared to Australia. So more opportunities, more jobs in Australia, higher salary in Australia. So choose Australia instead of New Zealand. But we can help you for Australia also. We can help you for the New Zealand as well. So this process I mentioned is conducted by the Australian Pharmacy Council. So this is the documents we need for skill assessment, like your degree, your transcript, registration as a pharmacist, passport, national ID like Aadhaar card, birth certificate, passport photograph. So fees you need to pay around 70,000 Indian rupees. Okay, to Australian Pharmacy Council you need to pay. And step two, basically the exam. So exam is very easy. As I mentioned earlier, knowledge assessment of pharmaceutical sciences. These exams you need to pass in order to migrate to Australia and New Zealand. And this fees you need to pay around 1.2 lakh Indian rupees. So this is very clear. No negative marks for this exam. So this is a very easy exam. In passing, marks required only 50%. Okay. So in a day, paper one and paper two, you need to give in the same day. Okay. So for example, in the morning 9 to 11, there is a one paper one, and then 1 hour gap. Then you have to go for paper two. Okay. And the question they will ask you in the four domains. Domain one pharmaceutics, domain two pharmacotherapy, domain three pharmaceutical chemistry, domain four is the pharmacology and physiology. So paper one cover pharmaceutical chemistry and pharmacology and physiology. So 30% they will ask you from chemistry part, and 70% the questions from the pharmacology and physiology. And same for so take 30%, 70% is the pharmacotherapy related questions. So once you give this exam, after 2 to 3 weeks, you will receive the result, whether you pass or fail. So in the result, they did not mention the percentage. Whether you got 50 marks or 90 marks, you are the same. You just need to pass this exam. And this exam is really very easy because it is a 50% marks you require to pass and multiple choice questions and no negative marking. Okay. So these are the exam centers in India currently, like Delhi, Noida, Gurgaon, Pune, Mumbai, Bangalore, Hyderabad, and Chennai. Here you can give this exam. An exam they conduct yearly 3 times, like March, July, and November. So whenever you are ready, you can write this exam. And from academically, a lot of students pass already. They are working, living in Australia. So our 93% students pass from our company in the first attempt. So English, basically, you have to go for like IELTS academic or PT academic or OET. So any English test you can give. So IELTS required 7 individual band, PT required 65, or OET required the B band. Okay, score B. So in this pharmacy need 2 year work experience. So someone have 2 year work experience, so they also can migrate as a industrial pharmacist. But more jobs, more opportunities in the retail pharmacy or in the hospital pharmacy in Australia. Same for technician, required for 1 year experience. So someone have 1 year experience, they can apply for technician. We also help them technician. We also help for industrial pharmacist. And these are the visa you are going to get, like 190 PR visa, 400 regional sponsored visa, 407 training visa, and this work visa 4824. Also, you are eligible once you pass this exam. So first job, basically, for you once you pass this exam and migrate to Australia, first job you have to work as a intern pharmacist for 1 year. So it is a job, and you will get the salary around 3 lakh Indian rupees per month. And after 1 year, your salary is going to be 4 to 5 lakh per month. Okay. And average time will take around 6 months to 1 year to complete this process. And you also can work like hospital pharmacist, retail pharmacist, consultant pharmacist, clinical pharmacist, all these other positions are available in Australia. So these are some of the reviews from our students who have passed this exam, and you can contact us in our these numbers. And thanks for listening. So I'm happy to take your questions. So you can ask now if you have any doubt or any questions.
So right when you have joined the meeting, Vaishnavi Lokhande have asked. She's from final year B Farm.
Hmm.
So she's looking for a job in known core domain, like clinical data management. So if you could comment on the same, it would be great, sir.
So basically, if you are looking to migrate abroad, so you need to work in hospital pharmacy or retail pharmacy only. Okay, so there is a bright future in abroad. You will get a job. Okay, but if you are working in like medical writing, medical coding, clinical research, or medical like pharmacovigilance, these kind of jobs not have the scope in abroad. Okay, so this CDM, if you are looking, you want to be only in India, want to work, then you can go, you can start basically from CRC, gradually you can become a CRA or CDM also you can work. There are opportunities in India, but for abroad you have to go for pharmacist jobs. That will be good for you. Yes, please, any other question? Pharmd student, any question?
Sir, could you please elaborate a little more about KAPS exam pattern? Atharva Nande asked.
Exam pattern is very, very easy. They ask basically, as I mentioned, that pharmacology, physiology, and chemistry related questions in paper one. In paper two, they will ask pharmaco therapy plus pharmaceutics. 50% marks required to pass the exam, and this is really easy exam if I compare with like GPAT or NIPER JEE. So this is really easy exam. If you can correct 35 questions out of 100 in, then definitely you can pass the exam, because that's the 65 questions. If you just guess, definitely you can correct more than 15 questions. So yeah, and if you have any specific questions regarding this CAPS exam, so you can ask. It's an easier exam, As I mentioned, that 93% student passed from our academy, in the last exam. Really easy exam. If there's no negative marking, so you have to attend all 100 questions. So passing is not a problem. Yes, next.
So students, I request everyone to ask your doubts to the maximum. Like there is no like small doubt or big doubt. Something is not clear to you, you can ask that as well. Any of the steps or any of the pathways that have been mentioned over here. आपको कुछ भी clear नहीं, like you can even ask in Hindi, right? So please ask questions, students, so that you can make this useful to you to the maximum. I know these students have the tendency to ask each other the doubts that won't be of any use to you, right? I'm sure about that. So please ask us the doubts so that we can have it cleared for you in a better way. Uh, Prasanna is asking how much score is needed in IELTS exam.
7 individual went in IELTS.
So, Prasanna, three examinations are approved by the government currently: IELTS, OET, and PTE examinations. So, you can take any of these three examinations for the same, right? Any other doubts?
Please fill this form. So you can talk to our team one on one. So if you have any questions or anything, they will give you video. You can talk to them on video, conference one on one. If you're not able to ask me the questions, you can just directly fill this form. And even we also send time to time email. Is there any opportunity in any other country? Okay, so please fill this form. So you will get a lot of new information regarding not just the but any other countries also. And I also request you guys to please follow me on Instagram and YouTube. So I always make new videos, new content, like for example, this is the 10 questions related to pharmd. So a lot of pharmd students always ask me, the question. So I made this video. This is for like how to become a pharmacist in Korea. Okay, so I always make basically videos for pharmacists, and this from Canadian pharmacists. So you can find a lot of new information, and we also uh, mm, send information if we have any new opening in any other country. So please fill this form so we can contact you in future. Based on your and this, and also subscribe this YouTube channel, so you will get a lot of information for pharmacist opportunity in abroad, if you are looking to market abroad. Okay, and also on Instagram, we are in also Instagram also, so you can follow this academically basically page. So we have a academical.ai. So we have a lot of information here for you. Or yeah, I'm also here, Dr. Akram Ahmad, Australia. You can find me here on the here as well on the Instagram. So Instagram, YouTube, follow us. So we make content, around you. Is there any update or any information? Okay, I think, I mean, you can guys continue. I'm
Yeah,
leaving.
we can do that, sir. Yeah, I
Sure,
would
sir. Sure.
request a faculty member also if they have any questions. They might come across students may approach faculty members also with a lot of questions. So you can also ask on the behalf of your students.
Yes.
Vaishali, are you saying something? You're on mute actually. So people over here who can immediately implement whatever things that we have told today would be the final year students and the interns present over here, right? So if your goal in your life is to have a better career out of your life and the efforts that you have put in these many years in your studies, right? So if you are having something like that, this would be something that you can consider. There is nothing mandatory over here. We will never say that because there is involvement of time, effort, and money in the same, right? So please have your doubts as much cleared over here so that you can utilize the information in a better way. I would always request you that. Right? We have few more minutes that we have blocked from your calendar for today's session. So please ask as much as doubts you can so that we can have it cleared for you students. Final year students. So we had Pooja is from final year B Farm. Atharva already asked his doubt. So Atharva, since you are already an intern, right? Any other doubts also you have, you can have it asked. And as Mr. Amin had told, I request the faculties, you might get few points that could be helpful for the students in the form of doubts. So please ask that so that we can have it addressed over here and clear it for you. Do we have anyone who have joined in the last or who might have missed in the initial parts of the webinar right now? You can just raise your hands to check if there is anyone. Bharat, is there anybody else? Bharat, which year you are at currently? What is the course that you do? Bharat, you can put in the chat box also. Currently, you are at which year and what is the course that you are doing? Anybody else who have joined in the last? If I missed something, you can raise your hands and mention your year and course that you're doing right now. Is it B Farm or is it Farm D or is it M Farm? and what year you are at present. You can just drop it in the chat box.
Bharat, I would request you to unmute yourself and ask your questions, or if
Right.
you
Bharat, आप
in the chat box.
yes, yes, आप हिंदी में भी पूछ सकते हो. No limitations or language barrier we have over here. तो आप एक बार अनम्यूट करके आपका कंसर्न पूछ सकते हो. It would be great, Bharat.
सर am I audible?
Yes, yes, Bharat, please
सर
ask.
मैंने अभी ज्वाइन किया है सर.
अच्छा, आप कौन से ईयर में हो अभी?
First year pharmd. Sir, actually I want to ask one question. Sir, after pharmd, I want to go in UK for MS. Then which entrance exam is required for that?
You are planning for a study abroad thing. Is that so, Bharat?
Yes, after pharmd, I want to do MS
Right.
abroad.
Right. So majority of the students that we meet, जिनसे भी हम मिलते हैं, उनका कॉमन कंसर्न यही होता है कि हमें पढ़ाई करने के लिए जाना है. तो ताकि लाइक आप किसी और से भी बात की होगी, मतलब मे बी समवन फ्रॉम योर फैमिली जो पहले जा चुके हैं और ऑलरेडी देयर वहाँ पे, या किसी कंसल्टेशन फर्म से आपने बात किया होगा, तो दे मोस्टली सजेस्ट अबाउट स्टडी अब्रॉड प्लान. ठीक है, तो जिसने भी यहाँ पे बात की होंगी, उनको मैं ये समझाना चाहता हूँ, फॉर एन एजेंट और फॉर एन एजेंसी, दे गेट अ गुड अमाउंट ऑफ मनी एज कमीशन when they do an admission of an Indian student to any international universities or colleges. ठीक है, तो बहुत बड़ा रकम उनको मिल जाता है. Right? So इसीलिए अपने सेशन की शुरुआत में sir, I have mentioned academically I have two kinds of services. One is preparation for the license examinations and the processes we support our students. Second is the study abroad guidance specifically. So study abroad we usually don't suggest. I'll tell you why. So same like Bharat had asked over here, we want to do an MS program in a country called UK, right? And
Yes,
hopefully,
sir.
Bharat, after doing that MS program, you will be wanting to work in the pharmacy domain itself, right?
So basically in clinical pharmacy, hospitality and clinics.
Clinical pharmacist or
Yes,
hospital
sir.
pharmacist is what you want to be. One thing you
Yes.
have to understand is that, Bharat, however or how much course you do, whatever course that you do, ठीक है, हमें तो लाइसेंस चाहिए होगा वहां पे काम करने के लिए, जो भी कंट्री हो. इंडिया में भी आप एग्जाम्स लिखते होंगे, राइट, फॉर द लाइसेंसेस.
Yes,
So
sir.
the process would remain the same. ठीक है, तो we tell you why we have spoke about Australia or the opportunities in Australia currently is that for getting your registration as a pharmacist and to make yourself eligible to work as a retail or an hospital pharmacist, आपका जो भी graduation है अभी फिलहाल, that is your bachelor's or your pharmacy doctor का graduation, वो काफी होगा. They are not even asking experience. ठीक है, तो जिनके लिए जो एक्सपेंस होगा, so imagine if you are going for a study abroad plan, you will be spending more than 30 lakhs of rupees on a minimum basis. वो 50 लाख तक होगा आपका जो एक्सपेंस होगा अपने साइड से. It is not even 10% or 15% आपका जो एक्सपेंस or the amount that you will be spending for your license with the eligibility that you are already having is much lesser than that amount. Around 10 लाख से भी नीचे होगा आपका जो एक्सपेंस जो है for getting a registration as a pharmacist you will be spending. For a country like Australia, it is less than 7 lakh Indian rupees. तो आपको सोचनी
Okay.
चाहिए कितना अमाउंट हमें स्पेंड करना है, और हमारा पेरेंट्स जो है उनको ही हम डिपेंड करते होंगे जो भी है. तो आपको ये सोचना है कि क्या हमें उनको स्ट्रगल में डाल के हमें जाके ऐसे कुछ करना चाहिए जिसके बाद हमारा जो जॉब होगा वो थोड़ा और डिले हो जाए, या हमें ऐसे कुछ करने चाहिए जिसके बाद हमारा करियर सिक्योर होगा. तो देयर इज अ डिफरेंस बिटवीन अ फुल टाइम जॉब एंड अ पार्ट टाइम जॉब. I always tell this to my students, right? There is a very great difference between a full time job and a part time job. आप स्टूडेंट वीजा पे जाओगे तो आप पार्ट टाइम जॉब जैसे करोगे, like you might be working as a carer, right? You will be taking care of kids or old age people, helping with their day to day activities like a maid, or you will be working as a delivery boy, or you will be working as a packing staff, or you will be working as a steward or stewardess, right, in hotels. ऐसे काम मिलते हैं. फार्मासिस्ट नहीं होते हम कभी भी. फार्मासिस्ट बनना है तो हमें ये लाइसेंस प्रोसेस के थ्रू जाना होगा. right? And whenever you are choosing a country, an abroad country where you want to work for, आपको ये चीज देखना है कि वहां पे जॉब अपॉर्चुनिटीज कितना अवेलेबल है और उनका
So,
बेसिक. हाँ.
so because US and UK में like ज्यादा opportunities है. If you do pharmd in India and उधर MS किया तो वहाँ पे बहुत opportunities है as compared to other countries. So
आपको कहाँ से पता चला था ये इंफॉर्मेशन? फ्रॉम वेयर डिड यू हैव गॉट दैट इंफॉर्मेशन?
you Google.
गूगल करके आपको देखा था, राइट? हाउ मच नंबर ऑफ वैकेंसीज आर देयर? डू वी हैव अ काउंट? डू वी हैव फिगर्स?
No
और
sir,
हाउ मच,
इतना depth में नहीं.
राइट, एंड हाउ मच इजी इज द प्रोसेस? लाइक एमएस तो आप करोगे, एमएस तो करने के बाद आपका एलिजिबिलिटी होना या रजिस्ट्रेशन मिलना कितना आसान है वहां पे, और आपको कैसा वीसा मिलता है उसके लिए, राइट? हाउ द कंपनीज डू द हायरिंग प्रोसेस. These are the things that you get into the knowledge of, right? So today's session is an awareness session that should open your eyes so that आप घर में जाके अपना research करोगे. You get into the details. So when you get into the details, you will be getting answers, right? So
Okay sir, yeah.
getting a permanent resident visa in UK is a difficult task. तो आपको तो पता ही है, बहुत सारे इंटेंट्स अभी फिलहाल है, एफर्ट लगाइए, सारा चीजें कॉन्सेप्ट जो है समझिए, ताकि जो भी जितना भी डिफिकल्ट सिचुएशन आपको आए लाना होगा वो भी आप ला पाए, राइट?
Yeah.
So whenever you choose a country to migrate, always keep your first priority to be working there. So full-time job or part-time learning choose करें after your graduation. So if you go to an agent, they say that you do this abroad, study abroad program, easily you will get a job. ये नहीं बताते कि क्या जॉब आपको मिलता है, और उसका if and buts कोई नहीं बात करता, right? It's not just to Bharat. We have other folks also inside the meeting. I would like to communicate this to each and every one of you. If anyone among you is planning for a study abroad plan, do think twice. हमारा एक्सपेंस कितना है उसमें, जो योर रिटर्न ऑन योर इन्वेस्टमेंट कितना है, 30 लाख या 30 to 40 lakhs ऑफ इंडियन रुपीज. कहीं पे भी आप जाओ कमाने के लिए तो टाइम लगेगा, वो कितना टाइम में आप कमा पाओगे? These are the things that you need to understand about. So Bharat, is that clear to you?
Yes sir.
And
Yes. Please, others also,
I'd
please.
like to add one more
Yes.
thing in Bharat. Right, Bharat, so if you are planning for MS, definitely you can plan, but I would suggest you that once
Bharat,
you
is that clear?
complete your pharmd, after pharmd you take the permanent residency in any of the country after writing the council examinations, and once you become a registered healthcare practitioner there in the country, and once you become a resident of that particular country, then you can plan to have your master degree, MS or any other degree, because they will charge you, being an Indian overseas, they will charge you much higher fee. There in the country, and once you become a resident of that particular country, they will charge you plan to have your right, and there will be a lot of difference as an Indian overseas and after becoming that particular country resident, right? So it is advisable that post completion of your pharmd, you apply for a job there, clear the council examination, get your PR visa, work there for some time, then you pursue your master degree and higher education there.
Okay
Right?
sir.
Yeah.
Yeah.
Yeah, you carry on, Shiva.
Others, please ask your doubts. Right. So I say for the final years, we have a first year student who is still worried about his career and his opportunities. It is high time for each and every one of you from the final years to raise your concern. आप पूछिए हमसे डाउट, सर ऐसे नहीं हो सकता, वैसे नहीं हो सकता.
Hello, sir.
जी वैष्णवी, आप पूछिए वैष्णवी.
Yes, you say that when we talk about retail pharmacy and the clinical pharmacy, which has the opportunity in Australia, or also we can say the core pharmacy, which is include the formulation and all. But usually, some of the people say then there is so much workload in core pharmacy when we can compare to the non-core like domain like CDM, medical writing, and all these things. So, is it true or not?
Workload, salary, or the remuneration for your work that you do, other benefits depend on where do you work. Okay, so workload might be more in India, right? But in a country like Australia, they are taking care of your work-life balance also, right? You will be getting more amount for doing overtime. जो इंडियंस फेमस है ओवरटाइम करने में, वो भी आपको एक लिमिट के ज्यादा आपको करने भी नहीं देता है गवर्नमेंट. So that's what I'm saying. Research, when I told you do the research about all the factors and never compare or never think that whatever that is the scenario in our country, in another country, it is going to be the same, right? The rules and regulations are pretty much strict in all of these countries other than our country. Sorry to say that I'm not blaming anything, but it is a fact. Is that clear, Vaishnavi?
Yes, sir.
Yes. So Vaishnavi, like one thing, like you are wanting to look for another domain, right? Like मानो clinical data management या मानो, ठीक है? तो एक
Yes.
abroad country में job देखना है, तो what usually we suggest is that like the pharmd students over here, they are more interested into the clinical pharmacist role, right? Rather than the retail or hospital pharmacist role. So they have another examination that they need to write from Australia itself for the clinical pharmacist job role, right? So better option is that they are anyways eligible to write KAPS examination and get their registration as a pharmacist there, which assures them a job in that country. ताकि आप कैप्स क्लियर कर दिया और इंग्लिश टेस्ट आप क्लियर कर दिया, यू कैन डायरेक्टली अप्लाई फॉर अ परमानेंट रेसिडेंट वीजा जो आपको अप्रूवल हो जाएगा गवर्नमेंट की तरफ से. So you can fly down to that country and start working there. ठीक है, क्योंकि जॉब अपॉर्चुनिटीज है वहां पे, तो आप वर्क करना स्टार्ट करो एंड यू कैन स्टार्ट अर्निंग गुड अमाउंट ऑफ मनी. डोंट स्टॉप एनीथिंग. आप लर्निंग करना भी नहीं स्टॉप करो. इफ यू वांट यू कैन डू अ कोर्स, यू कैन डू अ हायर स्टडीज आल्सो, and also you can look for the requirements whatever is necessary to become a clinical data management job role. ठीक है, तो उसी के लिए आप अप्लाई भी कर सकते हो, तो ताकि आपका अर्निंग स्टॉप नहीं हो रहा है और आपका टाइम भी वेस्ट नहीं हो रहा है. So you can look for opportunities because these kind of opportunities are limited there. नहीं तो बताते हैं ना गवर्नमेंट की इनका भी रिक्वायरमेंट है हमें, तो वो बहुत लिमिटेड है. तो इसीलिए वीसा मिलना एंड जॉब मिलना उतना आसान नहीं होगा. हमें फर्स्ट टेक केयर करना है कि टू गेट अ जॉब एंड स्टार्ट वर्किंग वॉट एवर जॉब रोल इट इज, बिकॉज वी आर नॉट हैविंग एनी अदर इश्यूज लाइक दैट, लाइक यू नो वर्कलोड और वर्क लाइफ बैलेंस, एवरीथिंग इज टेकन केयर. You are even paid during your internship times. यहाँ पे India, not like in India, you know how we get paid for the internship. It is very different. You are making around 3 to 4 lakh of rupees, Indian rupees, during your internship time per month.
Yes, sir.
Any other doubts? So we have Mr. Ali over here. So he is one of our team members. But good thing is that Mohammad Ali has also cleared his KAPS examination. Right? So you can ask him directly, as a senior or someone from your own industry itself. So उनका experience कैसा था while writing the KAPS examination? How was the examination for him? How he did his preparation? Everything you can ask. He is also here. तो आप पूछ सकते हैं, मतलब जो भी जैसे वैष्णवी का कंसर्न्स है. सो अली, इफ यू हैव एनीथिंग टू एड्रेस, प्लीज यू कैन अनम्यूट एंड एड्रेस हियर द स्टूडेंट्स. आपका एक्सपीरियंस कैसा था अबाउट द एग्जामिनेशन एंड हाउ इट वाज ओवरऑल अराउंड?
Yeah. Hello, everyone. Am I audible?
Yes, yes.
Yeah. So, anyone can ask question regarding the examination, like KAPS. और मैं देख रहा था कई सारे स्टूडेंट को कंसर्न है लाइक क्लिनिकल फार्मासिस्ट के रिगार्डिंग. तो आफ्टर क्लियरिंग KAPS दे कैन अप्लाई फॉर, आई मीन देयर इज एग्जाम आफ्टर क्लियरिंग KAPS फॉर क्लिनिकल फार्मासिस्ट. सो आप क्लिनिकल फार्मासिस्ट भी बन सकते हैं. उसके लिए आपको MS करने की या हायर स्टडीज करने की जरूरत नहीं होती. that will be very easy after clearing the KAPS examination.
अली आपका एक्सपीरियंस कैसा था, मतलब कितने कितने महीने तक ट्रेनिंग किया आपने?
मेरा ट्रेनिंग ऑलमोस्ट 2.5 month का था, और आई वाज स्कैर्ड अबाउट द एग्जामिनेशन, बट इट विल बी वेरी इजी. वो काफी इजी रहा और फर्स्ट अटेम्प्ट में ही वो क्लियर हो गया, तो एग्जामिनेशन से घबराने की जरूरत नहीं है.
Yeah, so there is a like 4 months training program which we used to conduct, and in between the training program we assess your skills also, right? So what we do is we keep checking that whether you are progressing towards your KAPS examination skills or not, which is required to write the examination. So if you do well in the mock test and you feel that you will be able to clear the examination and your faculty will feel that you will be able to clear the examination, then we will suggest you to sit in the upcoming examination. Otherwise, if you're not doing well in the mock test, then what we will suggest you that don't take the examination, keep training yourself for 2 to 3 more months, and then when you feel comfortable, then you can write the examination, the upcoming examination. Because examinations are going to be held 3 times in a year, March, July, and November. So in design this training program in such a way that we will keep assessing your skills, and whenever you feel comfortable in writing the examination, you can sit in the examination and clear at the first attempt. So Ali ne 2.5 महीने की preparation में ही clear किया, and we provide the training for 4 months, right? So now you can assume that the people, those who are putting 1 or 2 hours effort every day, he or she will be able to clear the examination easily. So it's not very tough examination. Yeah, any other doubt? Anything, guys? We are done. I think now it's 3, so we have taken your 1 hour's time.
Yes, students, once again, we have shared a feedback form in the chat box. So please have it filled. आप अपना suggestions भी दे दीजिएगा हमें, so that we can make the upcoming sessions for you better. Right? जो भी doubts है जो आप यहाँ पे पूछ नहीं पाए, and if there is someone who have joined in the last and who wants to have a better career out of their domain, right? Please ask us. Please mention that over the session. Please rate us also. How like out of 5, how much would you give for the sessions that we have taken, so that it will be helping us for making our future sessions better, right? So please have the feedback form filled, and we are still waiting for you, right? So जो भी doubt है, कुछ भी doubt है तो आप पूछ सकते हो हमसे. We will have it cleared for you here itself. We have no issues with that. We have taken your time till 3 o'clock. That's why we were saying, right?
Surbhi also is here. I think, Surbhi, do you have any question, or everything is clear? So we are good to go ahead and drop off now.
So for now, actually, it is all clear.
Okay, great.
But when we will go in deep, then we will understood that what all doubts we have.
Not a problem. So we keep conducting those kind of awareness sessions in your college also, and we keep doing like in multiple colleges in India. So this is not your first and last session. So whenever you feel comfortable, students are available in the campus, you just call us, and then we will organize those kind of sessions again, right?
Okay, sure, sir.
Yeah, great.
Yes. Thank you, sir. It was a great lecture and great program, and it will be beneficial for students as well. Thank you.
Absolutely, Sylvie. Thank you so much for coordinating with us and participating in the webinar. Thank you, everyone. And please do feel free to get in touch with us by filling this feedback form. If your questions are unanswered still, you can fill that feedback form and leave your question there. We will connect you one-on-one and clarify your doubts.
Sure, sir.
Yeah, thank you so much. Thank you.
Thank you, sir.
Thank you so much, everyone.
Thank you.
Thank you, sir.